Hi there, and welcome to Module 7, which is Class Management Techniques and covers both in-person and online training. My name is Dr. Sharlene Greenwood. I'm a consultant physiotherapist at King's College Hospital in London, and I'm also an honorary reader in exercise and lifestyle medicine at King's College London. I am presenting this module on behalf of myself and also Krista Stewart. Krista has a Master's of Science in Kinesiology from the University of Manitoba and is a certified exercise physiologist through the Canadian Society for Exercise Physiology. The objectives for Module 7 are to learn how to confidently lead an exercise session and get practical class management techniques, to develop strategies for group cohesion, set expectations, and build leadership skills to keep your sessions on track, to understand your scope of practice, when to refer out and how to ensure you and your clients are protected, and to learn techniques and resources for online program delivery and assessments. So we're going to start off by talking about in-person classes, and we're going to cover administrative tasks, registration, venue, the instructor and trainer, and also contacting participants. So first of all, administrative tasks. It's important to develop a class itinerary together with registration, attendance sheets, and participant information sheets, and to do this ahead of the class. To book a facility, any instructors, any rooms that need to be booked in addition, for instance, if you're doing a breakout education session, audio-visual equipment, and also any presenters. So if you're doing education and you need, for instance, a dietitian to come along. It's important to advertise the program. This might be in a renal unit, or it might be somewhere local in the community. Get together the class supplies, so a whiteboard or paper, together with markers, pens, name tags, any folders, and also facility or parking passes that are going to be needed. And then to assemble all the paperwork, so you've got forms, handouts, consent sheets, and also any questionnaires that you're doing as part of assessments. In terms of registration, it's important to know whether it's been a self-referral from the participant themselves or from a healthcare provider or other, that there is physician clearance and the renal team know about the participant's desire to exercise, that you have appropriate class numbers, so that you're only registering the numbers which are going to meet the requirements to run the class, that you're collecting together name, phone number, email address, the modality, so whether a participant is on, for instance, dialysis or transplant, what unit they're from, as well as a date of birth for the participant. And it's always nice to also invite one support person to come along to class. Have a think about whether there's going to be a cost for the class and how it's going to be funded. Is this something that you can start off with charity funding, for instance, or is there going to be a minimum cost to the participant to cover the class being provided? In terms of the venue, it's important to look at the environment and also the safety. So having good lighting, that it's spacious, and so there's room to move about, for instance, with walkers or any other mobility aids. And then just to think about the space. So any space can work. It doesn't have to be a gym. It could be a community hall or somewhere that is just big enough to host 12 people or so doing an exercise class. It's important that there aren't any loose mats or other tripping hazards, and that there is any medical or support protocols in place. For instance, where is the AED located within the facility? When thinking about equipment, make sure it's appropriate and it's accessible for the participants. It should have regular safety checks and calibration, and you should have the documentation to prove this. Lots of different equipment might serve you well, so you might be looking at tubing or different types of gym bands, also free weights, so dumbbells or barbells, kettlebells, but also if there's no actual exercise equipment available, things like soup cans or water bottles make good alternatives. If you do have machines available for cardio or resistance training, then that's great. You might have a bike or a treadmill, you might have a multi-gym. And then also think through some of the things which might be useful to do in terms of games to maintain motivation. So this is where things like pickleball or card games, bowling can be a nice alternative to intersperse in between exercise sessions. In terms of the instructor, it's important that the instructor has CPR and AED training and that they have the appropriate first aid training. They need to be experienced and knowledgeable and, importantly, qualified to be leading whichever class it is that they're leading. They need to be educated in an overview of kidney disease and exercise. And for this, you can see modules 3 and 5 and also the life option material. The instructor should arrive early to set up the room, make sure the equipment is okay and that any paperwork is ready. And it's important that the instructor keeps the participant information updated. So anything which is being used for the class, but also any information on the patient is kept up to date. In terms of intake and exit assessments or baseline and exit assessments, these are really important. And again, these are things which you can find in earlier modules, such as Module 4. In terms of the contact for the participants, they need to know the date, the time, and the location of the class, where they should park, what they should wear, and then what to bring along. So, for instance, any medications they might need, or if it's appropriate for them, something like a glucometer. And then again, the baseline assessment, when that's going to be for the participant, and is that prior to the class starting, or is it going to be done once the class has started? So in terms of class structure, we're looking at including introductions, what are the participant class expectations, and also then what is the instructor class expectations. And these are important to set as ground rules right at the beginning of the class so everybody knows what their expectations are. So introductions, on the first day especially, it can be really helpful to have name tags so that everybody knows and can try and remember and learn people's names. It's important to provide the instructor contact information so that participants can let the instructor know if anything has changed or they have any questions or if they can't make it to class. It's also a good idea to ask participants to share their name, why they've joined or how they've heard about the programme, maybe what their stage of CKD is with the rest of the group, just so that people start to learn a little bit about each other. An icebreaker game can be really helpful here as well, just to get people talking and get people to feel less nervous about being included in a group environment. It's important to give an overview of the programme and to hand out any itinerary and go over what's going to happen on the day and then on subsequent classes. It might be an opportunity to fill out paperwork, so doing the consent or the waiver, doing any health screening or pre-evaluation assessments. Having a tour of the facility is always a good idea so that people understand what the different exercise equipment is and also where they might be able to change, where they can go to the toilet, and also any instructions around maybe arriving a bit early so that people can change before coming into class so that the class can start on time. In terms of the participant class expectations, so confidentiality and respect for each other. Attendance, so letting the instructor know if they're having to leave early or they're not coming to class. In terms of facility access, it might be that that facility only allows people to come during class time and they're not allowed to just come when they feel like it. So it's really knowing what the expectations are around that. In terms of attire, so having indoor shoes and having comfortable clothing that's appropriate for moving around. that the participant should follow their exercise prescription. So this might be set from their baseline assessment and then progress during class. To inform the instructor of any health changes, so this is if there are any injuries, if there's a change to CKD status, so maybe they are having a transplant, and any other health changes. It's also important that the participant understands that they can go at their own pace. There's no added expectations, and they should work to the exercise prescription that's appropriate for them, and that they're able to ask questions and ask for help if needed. The instructor class expectations include setting out a clear guideline or instruction for participants from the first day, being able to work to patients' own ability levels, so giving appropriate exercise progressions and also adapting any exercises to the individual's own needs. The ability to address issues as they arise immediately, to create a positive and welcoming and warm environment, and to also encourage people to be active outside of the class and beyond. In terms of class content, we're going to cover what exercises should be included, a little bit around education, how to maintain motivation, and then also around referrals. So what exercises should be included? So this is really dependent on the time, the space, the equipment availability, and also the ability of the participants in the class. But regardless of that, it should include both a warm-up and a cool-down, and then a combination of cardiovascular, resistance training, balance, and stretching exercises. It is important to make things fun and to maintain motivation and to give people new experiences. And this is where the inclusion of games or added exercises from maybe yoga or Zumba can be really helpful in terms of maintaining interest. Education session can be led by the instructor. It might be peer or patient-led. It could be another healthcare worker like a dietitian or pharmacist, or some other type of specialist coming in to give that education. It's important to present a variety of topics and to have integration with the participants so that it's an enjoyable experience. And this can be delivered before or after the exercise session. It can be delivered in person or also by video or internet. It can include also the use of props and take-home messaging, maybe in the form of leaflets, and also referral pathways. And something really nice to do is to set this up together with a tea and coffee and a biscuit, and also include a general chat and allow people to get to know each other. So you're really creating a community. It's important to maintain motivation, and to this effect, having SMART goals and making sure that the exercises are progressed, so they maintain being slightly difficult and challenging. And for this, you can see module 5 and 6 for goals and progression. It can help to use a rate of perceived exertion or SMART technology that also tracks progress, and to really go over the results from people's baseline assessment and also their exit assessments, so that people can really understand how they've progressed and how much better they might have done. It's important, as I just said, to create a group dynamic, and this really facilitates motivation and it just makes things more enjoyable. And to that end, having potlucks or other types of gathering or fostering community connections can make things much more encouraging and make things much more fun. Referring on from the program is really important so that things don't end when the program finishes. And for this, you can have exit routes such as walking programs, maybe going on to doing a bit of self-management, going to another community, or maybe a virtual program, something like Kidney Beam, gym classes, or peer-led groups. And it's also just really important to encourage and support the continuation of an active lifestyle at the end of the program. Okay, going over some organisation now. We're moving on to looking at online training. We'll have a think about some platform considerations. We'll look at the environment and also the equipment that we need. So in terms of what type of platform you might want to use, there are two different options. You could choose a free platform to deliver your training, or you might want to use a professional platform, something like Kidney Beam. So the pros for a free platform are that they're easily accessible, you don't have to have a big investment or any funding, and you can access a wide audience. But on the negative side, you can't include behavior change, it's difficult to monitor and progress programs or to evaluate outcomes, and there isn't any quality control. So for this, the professional platform, such as Kidney Beam, which is a kidney-specific online platform, the pros for that are the ability to include the behaviour change and other self-management tools, quality control of the content, being able to put programs together that maybe feed into each other, evaluation of outcomes, links to other wellbeing content, the ability to evaluate data and monitor engagement, and then also professional support for tech requirements, for instance, editing and uploading video content. The cons for this, though, are that it requires considerable investment to set up this type of platform. And then there are also GDPR or data control considerations if you're setting up this type of platform. In terms of the environment for online training, important to ensure a quiet room without any background noise that will be picked up by the microphone. Consider neutral and homely settings that replicate the environment that patients are in at home. It's important to have good lighting, and to this effect, consider possibly purchasing professional lighting sets. And then think about the props that you might use. A chair that you're able to show can be used to hold on to for support, a bar, maybe water bottles, cans of food, TheraBand, or any other equipment that you might be using in your class. In terms of equipment, so you need either a laptop or a computer screen which is large enough to be able to see your patients on the screen if you're delivering a live class. So quite often laptop screens aren't big enough, and you might need a larger monitor screen to be able to see, for instance, if you have 12 patients, be able to actually monitor them while you're doing the class. Important to have adequate Wi-Fi, both to be able to stream out to people, but also enough for the participants to be able to receive that information in their homes. It's important to either have a professional camera or a smartphone that is suitable for recording the content and ensuring that there's adequate storage, as both the video and audio content together create quite large files. Editing of videos can be done either using a software program or it can be done by a professional. And you might want to consider how you're going to brand your videos and any messages that you might want to top and tail your video with. A tripod is absolutely essential for doing any type of filming, as it's the only way to ensure consistent picture quality. And also consider using a professional microphone. When you're jumping around doing exercise, wireless one is usually best, and this makes sure that the instructions are clear for the participants. In terms of class preparation, moving on to safety, things to consider with the population, as in what we were talking about with the in-person classes, we need to think about physician clearance to be able to safely exercise virtually, any comorbidities that patients have, any medical protocols that need to be followed, blood pressure levels, heart rate levels, etc. And then also any movement restrictions that participants might have, for instance, if they have a PD catheter. It's important to have communication between the participants and instructors. This might be prior to a live session, or it might be having an email or a phone number available for participants to be able to contact an instructor and ask any questions or have any further clarifications. In terms of online safety considerations, it's important to have onboarding details and a safety briefing and disclaimers, and also to ensure that you have a duty of care and you understand what that duty of care is for delivering a live class. And we're going to go through all of those in a bit more detail. So the online onboarding needs to gather a patient history, so understanding the stage of CKD, so whether they're, for instance, dialysis, transplant, pre-dialysis, what comorbidities patients might have. And then the safety briefing document should be read by the participant, and the box needs to be checked as part of the sign-up. And this should include checking with the renal team that it's safe to exercise, information about safe and comfortable clothing, the setting that's safe for somebody to exercise in at home, and any hydration or medications that should be used. And then also a brief on what the participant can expect in the class and any potential risks. And then the disclaimer and the waiver, which, as I already mentioned, should be ticked, is done as part of the onboarding, that all of these things have been understood by the participant and they're happy to continue. Also important to consider participant numbers. And so if you're delivering a live class, just ensure that it's an appropriate number. We have 12 generally that we're able to supervise on the screen. Something to, again, consider is how you check in with patients before a live class. And one of the things we do on Kidney Beam is to run a live poll. And this allows us to check the suitability for that individual session for the participant. So this might be, have you done a class before? Have you had any recent injuries? So in the, since doing our last class, have you checked your blood pressure? Have you checked your blood sugars, if that's appropriate for you? And have you had any medications? And are you feeling well enough to exercise for that session? It's also important within our duty of care to have patient contact details, their emergency contact number, and also a number for their medical team. And this is just, if a patient disappears off screen, we're able to make contact, make sure they're okay. If we're not able to get hold of them, we're able to get hold of a next of kin or an emergency contact or their medical team. When we run live classes, we have a 30-minute cutoff, and this allows the instructor to check who's in the class and also to check about any comorbidities, or if the patient is new, we're able to make sure we've got an understanding of that person's level of ability so that we can tailor around them. Again, in line with that duty of care is having participant notes and also documentation that they've attended and anything that's happened during the session, and then any correspondence with referrers. In terms of content, you want to be able to take into consideration patients' health accommodations and any individual needs. It's important to think about stretching and also other types of exercises such as endurance and resistance training, thinking about different other avenues of activity such as yoga, Zumba, aerobics or swimming, thinking about modifications and progressions during online training, and then also how you're going to do outcome assessments. So what are the online considerations with doing that? So what content can be included for online training? So looking at general exercise sessions, or as we call it, renal rehab sessions, we run a warm-up and a cool-down with every class, ideally aiming for at least 10 minutes of each. And then we do a combined aerobic and resistance training session. And again, ideally 30 to 40 minutes. And we deliver these both in seating and in standing. Seated and in standing, and this allows for us to be able to deliver the exercise training for different levels of ability of our participants. You might want to consider progression of difficulty. So if you're doing a combined class, giving beginner, intermediate and advanced instructions, but also if you're designing programs of on-demand content, considering packaging up beginner, intermediate and advanced programs for people to follow. As with in-person classes, we also deliver education, and this is kidney specific, and this might be also including sessions with, for instance, the dietitian or the pharmacist. Thinking about other movement classes you can include, so yoga, dance, Pilates, Zumba, any type of activity that gets people moving is ideal. And then you might also want to consider thinking about adding in some other content, so nutrition maybe around weight management or prevention of weight gain, possibly post-kidney transplant, and then also emotional well-being, so mindfulness, meditation, possibly something like art therapy. When thinking about online training and outcomes, you might be able to do these in person and then deliver the content virtually. But if you're just doing things virtually, then you want to consider the environment, the instructions, and how you're going to record and display the outcomes. Will you do the outcome during a live session? So maybe a one-to-one live video session, or are you asking the participant to do this themselves at home and record this either on the platform or give it to you to record? Some ideas of things that we do are sit to stand 60 test, the step test, and the 6-minute walk test, and you'll have heard about these in previous modules. In terms of subjective outcomes, just ensure that these are appropriate to what you're trying to measure. So are you measuring quality of life? Are you interested in whether patients become more activated and more efficacious in their self-management, or are you perhaps looking at fatigue? Maintaining morale with a program is really important, and it's crucial to the success of any program. So establishing relationships with the patient is important, and for the patients to have relationships with each other, to create an engaging class, an environment, establishing those SMART goals, providing physical activity as well as education information, so that people are able to be more active outside of class. And then in terms of retention and motivation, building a community, thinking about different challenges and, possibly newsletters or other activities or social events. Specifically with online training, building an online community is really important and is a really good way to maintain motivation. And this can be done either via a social media platform or via groups within the actual professional platform itself. Having group and individual challenges is a great idea. We have had something where we've had people all doing walking activity and then collectively collecting their step count to see how far we can get up a mountain. It's a good idea to have progress emails and newsletters and blogs and nudges. So perhaps if somebody hasn't been at a program, maybe, or you've started a program, how are you getting on? Do you need any help? What can we do to get you back onto the program? It's good to schedule activities, and one of the things that we have on Kidney Beam is a dashboard where people are able to choose their classes, and it puts it into their diary. It then reminds them the day before and then an hour before that their activity is upcoming, and also gives them a link to go straight to class. It's important to have new content available online and also to have a progression of activities, and this is where you might want to have a beginner, intermediate and advanced program. Having an online tracker, so to track offline activity can be really helpful. So people might want to walk dogs or swim, etc., and want to still be able to record their activity and have that go towards their target. Important to include links to social activities and catch-ups, and any workshops that might be offered. For instance, during COVID, we did workshops around COVID and also around the vaccine. Social media marketing and group interaction on social media platforms can be really helpful and really give that accountability and make people turn up to class because they know that they've got people who are encouraging them or maybe noticing if they're not turning up. And then having celebration events, and possibly even linking these with special occasions in the diary like World Transplant Day. So lastly, talking about tools for success. For any type of class, that it's empowering, it's fun, and there's a positive environment, that it's consistent, and there's always encouragement for participants. that there's flexibility and you're able to adapt programs to the participant based on their level of ability and their input. That there's progression and we ensure that participants follow their exercise prescription to actually realize the benefits of doing exercise. To set up clear and consistent guidelines from the first day of class and address issues that arise immediately. And most importantly, for that engagement and that connection, it's really about partnership working with the participant. So well done, you've completed Module 7, Class Management Techniques, and the next thing you'll be asked to do is to answer a series of questions. Thank you for your attention.
Take a moment to evaluate your knowledge with the following self-assessment questions. Feel free to pause the video at each question to identify the correct answer. The correct answers can be found on the GREX website.